Is actually a weekend when an old favorite won the New York Mile as female. A young upstart from UK won the New York Mile in 3:53, 3 minutes and 53 seconds, going down Fifth Avenue this weekend, in which a new person or upstart won the U.S. Tennis Open female, who's worked a long time to do that, and who, as a old favorite, sort of won the men's U.S. Open at the same time. And of course, last night, if you didn't give up, you then saw Green Bay come back from 20-0 with the quarterback carried off on a cart halfway through, thinking there's no way they would ever come back, and they came back to win. The point of all of this is that was all exercise. Every one of those events was exercise. And what was driving those people to do it? They were doing it probably not just because of exercise, because some other excitement was in the game for them. Some other excitement drove them to do that and train for that exercise years and years as it goes. Today here, we're trying to figure out what is the motivation we could put in an office visit that will turn people on to that, or those joys of exercise, so that they go out and do it because they want to do it. If you tell people you have to exercise just for the good of exercise, it works for a while, but it doesn't last for a period of time. You have those people come back and back. We have two speakers today, Dr. Wonnacott and Ivey, who are going to tell us how do we approach the patient in the room to try to convince them to the benefits and the improvements that they can see with exercise. And Dr. Ivey will talk about how can we make it more attractive to the average patient who's coming in so that they'll want to leave the office and actually exercise to improve their health. Dr. Wonnacott is the co-chairman here, and he's from the director of Barton Health. Dr. Wonnacott.
Thank you. I appreciate that. I hope that this, I don't know if I'm much louder with or without. We'll try it with. And then I can feel like I'm really doing something. I've got, a microphone in hand. It makes me feel a little bit more special. But I appreciate this small crowd. We expect many more this next time. Given the fact that I'm speaking today is just fine, but after today we're going to expect a lot more, so bring your friends, okay? But thank you, Dr. Balmer, for an excellent introduction. I spent much of my career moving around the world. I was in the Air Force. I was a clinician, family physician trained. I spent about 12 years just right there in the thick of things. And then the military moved me into a leadership position for about 10 years. And then I was able to see a different perspective, but trying to keep that clinician view of things was very important for me. And so now I have moved on up. I retired and I've moved up to Barton, which is in South Lake Tahoe. And right now is not a good time to go up there. There's too much traffic, I tell you. But it's beautiful normally during what we call the shoulder season, when it's after Labor Day and it's just beautiful with, but fewer others competing for those views, okay? But I run the Community Health Center, which we have primarily family physicians, or family practice, and OB and pediatrics. And we also have 7 specialties and robust telemedicine department. We're right across the street from Barton Memorial Hospital. Isn't that a pretty setting for a hospital? And one thing that's really unique is we've got this new Center for Orthopedics and Wellness that just opened up 2 months ago. Now, ortho has always been, sports medicine has been an important part, important piece to Barton's success. We have a lot of people come up and injure themselves, and it works out really great. But what is, I think, really remarkable is a lot was put into wellness, and this is now called our Center for Wellness, which is wonderful. We have some wellness programs that are quite unique, and a performance-based program that has elite athletes as well as me, you know, those who are not elite. Dr. Bertner, you can hardly see that. Dr. Greg Bertner is our lead. He's a family physician who then also is boarded in preventive medicine and does a wonderful job. So we have some exciting things up there, such as Med War, we call it. That's an adventure race for medics, and you can see them. This happened 2 days ago, right there on the lake. Lots of obstacles and things to do, which is a lot of fun. But not everybody up in Tahoe are the elite athletes. We have a very strong, you can hardly see these pictures, but we have a large service industry and a lot of folks who just don't have don't have a great lifestyle. It's remarkable to see the dichotomy there. And in our service industry, a lot of folks who are there just trying to make ends meet, and we at the Community Health Center serve primarily, as talking to Dr. Kohatsu, primarily Medi-Cal patients. But now, let's talk a little bit about just lifestyle. Lifestyle's dramatically different now than it was in the 1800s, when you had to work to earn to survive. You had to get out and plow and get out and plant, and you just had to spend the time, and there was only Whole Foods. There was nothing else but, right? And then even in parts of the world, it's still like that. I spent a month in Ethiopia with my wife, and we didn't see a single obese person there, and they're working hard for what they have. Unfortunately, the Western culture is a little bit more like this, and that doesn't lead to much success with what we're talking about cardiac events. So what I'm going to be discussing here is, first of all, some of the latest updates regarding lifestyle, where we stand as a nation in our failures and success regarding a lifestyle. We're going to talk a little bit about some of the tools that are available to us where we can maybe make more of a difference. And specifically, I'm going to talk a little bit about motivational interviewing, and then we'll also discuss my idea of a process that I could take back and you know, implement with my providers. So this is in the healthcare setting. How are we going to be making more of a difference? Now, I don't have any other physicians besides the three of us, four of us here, I think. Are any other physicians here? But you've all been in a physician's office. You all know what that's like, right? And so you've also had a survey ask you, as you've looked at that already, has asked you what has happened in previous encounters when you think that wellness might have been discussed but wasn't. And so look at both sides of that, and you can fill that out. And as soon as, in just a couple of minutes, I'm going to have Brian come around and pick those up, and then we'll tabulate those numbers. I'm interested in what you think might be some of these big drivers for the way we are really not doing great in our lifestyle. Speaking of not doing great, we received just 2 weeks ago up in our system the Community Health Needs Assessment. And that assessment asked numerous questions, and we found that we're still really struggling with mental health and substance abuse and access to care. But what was remarkable to me was that we are also really doing poor, and they asked this question. In 12, 15, and 18, they've asked the same question, which was, have you received advice about weight in the past year from any health professional? And look at that trend. 18, 21, and then this most recent one. Whoa! 11.9% said that, oh yeah, we have mentioned that. Remarkable to me. So we're not doing very well in what we need to do. I mean, we do okay, could be better we've talked about that this morning as well, on talking about blood pressure and talking about cholesterol. Still could be better, but not terrible. Elevated blood sugar, reducing blood sugar in that discussion, and stopping smoking. And sometimes, hopefully, we're talking about losing weight, even though you saw those stats. But we don't do very good right there in how we talk about those important factors of being active and eating healthier. Just poor from our perspective as physicians and providers. In fact, we're going to talk about diet for just for a minute here. You can see, it's hard almost to see on that screen, but this question was, how many of you consume 5 or more servings of fruits or vegetables in a day? And the numbers went from 54% down to 36% since 2012. So that's a relatively short amount of time, but just look at the trend. You see how remarkable that is, especially in the setting when I'm just showing the same graph here. We are not counseling and we're not helping our patients know the importance and how they might achieve some success in this area. All right, so a lot of what I'm going to be talking about is from this Journal of American College of Cardiology. Just came out really a couple of months ago, and or no, it was even more recent. This was just a couple of weeks ago. And in here, the recommendation was that we need to do a better job of helping folks have healthier eating options, to understand the factors that are causing our population not to eat well, and to figure out how we can better, put this into action. And one of the quotes that was in there was that suboptimal diet was responsible for an estimated 1 in every 5 premature deaths in the world in that time frame. So pretty remarkable. Probably the greatest part of this to me, this article, was this summary right here. So if you can, it's a little bit small for everybody, but at the top, we're talking about this is where we need to be, reducing the excess calories and focusing on the fruits and vegetables I just mentioned, focusing on the whole grains, and opposite of, avoiding the refined grains, going to the whole grains. Eating more of the appropriate amount of nuts and legumes and seafood, as well as talk about moderate alcohol intake. And that's a catch-22. We have 1 in 3 patients who are drinking alcohol have a difficult time keeping it at the moderate level. And so basically we say, if you haven't started drinking, that's great. Then you don't need to start drinking just to help your heart. It's not probably the best idea. But if you are drinking, fine, great. You need to keep it at this level, okay? And so then the next step was talking about the drivers for these disparity in, why we do poor. And these are some of the things that you have seen in this little paper I sent around. Okay? These are things that are mentioned as why we have a difficult time eating good food. And so you'll give me your own thoughts on what you think really is a powerful, what makes the most difference in keeping our population from eating what's right. We have the DASH diet and Mediterranean diet. We've talked a fair amount about that. You've all heard about that, and we've tried to have some example of that maybe in our lunch today. But how important is that for us to understand the keys that can make such a difference for us? Then we've got, on the right hand, we've got these various actions, and we can't go into all of these today, except I just noticed that right near the bottom it says, one of the actions we need is to discuss the standard of care for healthcare providers. Okay, so that's what's really important in my conversation right now. What do we do to make a difference here? And at the end, it just states that for us as leaders, we need to know these things. We need to understand what's part of a healthy diet ourselves, and We need to know how to learn about healthy food and learn about the research that's out there, can interpret the reports and understand the supplements. We don't talk a lot about supplements because there's not really great evidence. We just know that these kinds of diets will make a difference. It's a challenge to find some great evidence for a particular supplement that's going to fill the gap and make my heart all healthy. But we do know that these other general guidelines with diet can make a difference if we can just do something to bring us closer to that. And I also threw on here, it's important for me as a doc to know in South Lake Tahoe, where could somebody go and get a reasonable, cost-effective food that they could prepare, and how could they prepare it, and be able to share that with my patients. It may be different there than it is in other locations, okay? That's Emerald Bay. It's one of the most photographed areas of the world. It's kind of pretty. That's not my picture, unfortunately, but all right. Now I'm going to talk briefly about physical activity, and then we're going to have a great talk from Dr. Ivey that's going to add a good amount to this. But also recently, within the last couple of months, let's see, that was June 28th. There you go. We had the National Health Statistics report come out and say that 23% of all of our population are able to be as active as the guidelines say we should be. Not very good. When you consider that we've got such a problem with our weight, we've got 70% of us are overweight or obese, including me. I realized I was overweight when I looked at the chart. Not by much though, so I'm okay. But I mean, I'm working on it. But we're doing very poor at getting done what we need to do. Well, why? And this shows the areas that are maybe exercising better. And California here doesn't look too bad. So we're in blue, and blue is good. Where do you really struggle in the country? Right down there in the southeast. It's what we've seen for years now. But that's a remarkable graphic of where, and the percents, I can read it to you, the percents are 24% in California, so we're barely above the 23% average of this country. In other areas, you get over to Colorado, a little bit better, okay? Maybe it's that beautiful mountain that calls to people to get out and exercise, okay? This is South Lake Tahoe. So the question here is, have you had no leisure time physical activity in the past month? And the number went from back in 2012, a very small number. We're better up there because you've got a lot of this beautiful area to go active in. And yet look at that trend. We went from 14% to 20% in those 6 years, saying that they had absolutely none in the last month, absolutely no leisure time physical activity. That's pretty remarkable. Quite a trend. A fair amount of the next 21 slides are going to be things that came out of this really nice review. This is from May. And so routine assessment, this is right where I was looking at. When I, as a physician, have an opportunity to talk about physical activity with somebody, this has given me a bunch more oomph to what I need to be doing. And in here it mentions that, there's not really one single intervention that will make the hugest difference necessarily, that multiple behavior change resources might be needed, and that counseling does work. There are some stats that in some areas it's stronger and maybe not as strong, but it does something. It's good. And in fact, it says that many physical activity promotion interventions in primary care show similar to better cost effectiveness than drug-based interventions. So, hey, this is important. I need to do this. And USPSTF has agreed with that. And they said for those who are obese or have risk factors, we should be counseling them on physical activity. And when they say intense, and they're saying face-to-face and telephone contacts over multiple sessions, over several, I think that was supposed to say months. But so yeah, the USPSTF, that we have a hard time to make up their mind on a lot of things, they're saying this is good. And in fact, they said even for those who don't have risk factors, might be beneficial, okay? And then what I appreciated this sentence in that same journal, where they said, you know, despite all of the efforts, we're moving in that direction, we really need to have more pragmatic implementation experiences. Okay? We have to know exactly how I can put this into my clinic. What can I do with this? How can I really make this successful and spread that across the whole nation? So one thing they talked about is various self-report tools. And some of you, when you've gone to the doctor, maybe were asked about how your physical activity was. Well, they found 131 different questionnaires, and they narrowed it down to 14 that were really unique. They had 1 to 12 items, and they'd take anywhere from less than 1 to 5 minutes. That were various practices used across the nation. And this is a table you can't read, but this is, they outline each of those type of questionnaires. And some systems, like Kaiser with Epic, have linked this. That's right in their EMR. Okay, and so they can see exactly when my MA, if I were at Kaiser, is rooming the patient. This is one of the questions everybody gets asked. And they have the 2 questions. And this is probably what I've seen most frequently. On average, how many days per week do you engage in moderate to strenuous exercise? And they give that those examples. And then how many minutes do you engage? So how many times and how long? And then that information goes right into your record, and that gives the provider then the opportunity to discuss that. Okay? I really like this question. And this was, it's one question. If I can pare it down to one question, that's great. And it says, are you active for 30 minutes on 5 days of the week or not? And boy, you can answer it one of these 4 ways. No, I have no plans. I do not want to. I'm going to lay down on my couch. I do not care. Or, no, I haven't, but you know what? I've been thinking about it. I could do that. And then it might be yes, but not all the time. And sometimes yes, you know, I do CrossFit, whatever. Then you've got a lot of information with that one question, but with 4 different answers that can help me as a physician maybe talk about what we might do. They also in that article talk about WAMs. And I got to tell you, before, without even knowing that we were going to talk a little bit about wearable activity monitors, my watch died 2 weeks ago, and it was a dumb watch. It was not a smart watch at all. It kept time, but it didn't do anything else. And I said, we're going to go and we're going to get a watch. I was down at Carson. See, for us at Tahoe, the closest city is Carson City, Nevada, unfortunately. But we went down there, and I was in Costco, and then we're going to go just find a cheap watch, but Costco had the Gear S3 Samsung. And I said, whoa, $269, I can do that, I think. I've seen people use these, and let's try it out. I love it. I love it. Now, they did a review of 23 different monitors, and they came up with the Fitbit, one was the One and the Zip, as being probably the best. What's kind of nice about this one, this was kind of in the middle of the pack, but I can use it for everything. And when I'm in a meeting and my phone is buzzing, I can just go, oh yeah, I can ignore that one, you know? So I love these devices. This one has been a big difference to me. And when I wake up in the morning, it tells me how many hours I slept. Somehow it really seems to work. I don't know how it did that. It tells me how good my sleep was. So thank you, okay. So it is remarkable, but some systems are starting to get more and more into using these devices and putting them right into their records, okay, to where we can get information, data that can be useful in how I might counsel a person on their lifestyle. Issues being that they're not always consistent with, they may be saying that I'm doing perfect, but maybe not according to the guidelines that we have as approved, and that it is still a challenge to get this information into my record. So those are some of the challenges with it. But going back to repeating that, look, talking about this and really maybe motivating somebody to do that activity will really help us. And yet, these are our numbers across the nation. A person who has cardiovascular disease, 41% of the time is counseled on appropriate activity. 41, less than half. And you see these other numbers. That's very poor, in my mind. I mean, we could do so much better. But we're lower, as you see down at the bottom, than many other countries where we talk about this. And you can see that in the stats. Remember, I showed those numbers that we're just doing poorly. That's Desolation Wilderness. It's right above my house. It's really a backpacking paradise. I just threw that in just so you get some notes. So what are some of the barriers? Here in this article, it also talked about we just don't reimburse well for it. A lot of docs self-efficacy. I just don't know that I'm not going to be successful in that. I just don't think I can do that. We don't have enough support from our systems. We have a scarcity of community resources in many places. And not everybody has a center for wellness, like Barton. We have some poor care coordination in many places. Excuse me. And you can think of many other barriers. And it's mentioned in your survey now. If you looked at that, what are the things that really probably are powerful in getting in the way of having a doc talk to their patient about physical activity or a healthy diet? Okay, so let me give you some summaries here. Obviously, they say we need to make this a priority in all visits. We need to encourage people that the new technology is a good thing, is helpful. We really need to counsel people that this doesn't have to be CrossFit, you know. You really can go out and spend 10-minute bursts of doing a quick walk, and you get a lot of good out of that. And if you were to break up that 60 to 100 minutes into 10-minute little cycles, that really is easy to fit in a whole week's worth of time, and can make a significant difference. And then also talk about muscle strengthening and resistance and flexibility. Tailor it to those who are ready to change and versus those who are not likely to change. And assessment of physical readiness. I tell my docs it's not so important that we worry about somebody's going to go out and harm themselves by a little bit of an increase in activity. But it is good to talk to them about where they currently are, and then we feel more engaged and they trust us more. And so we can talk about this kind of activity, you know, you let me know how you feel with that. Finally, we need to walk the talk as leaders and as providers in you know, eating right and exercising regularly. And talks that there's many roles in our communities that all can be playing, you know, helping with all of this. So just the other day, I was sitting at my office and I was actually working on these slides, and this thing here got mad. And it said, it honestly did, it said, "You have been inactive for too long." This is a true story. And I said, okay, I guess that's right. And I'm getting kind of, you know, I'm tired looking at the screen. So I went outside and I walked past the Center of Wellness. And that's the center right there, the side that I look at from my window. And that's the bottom picture is looking from the back of the center out into, this is where my walk went. This is a picture from Friday, right there. Nice. Isn't that nice? So I went and I walked there, and it was really, really nice. Now, not everybody can do that. I understand that. Not everyone can do that. But you've got a lot of places You've got neighborhoods. Even in an urban environment, there are places people can get active. And if you get on these links here, you can get